Having rheumatoid arthritis, like 1% of us do, can bring our life to a sudden halt. In what seems like a flash, we can go from hardly ever needing to see the doctor to now having specialist appointments and a pharmacy full of new medications. Although this is a whole new world for you, this is your rheumatologist's bread and butter, as we see this every day. So today we're going to get into everything remission. We'll talk about what remission is, what you and your doctor can look for, and why sometimes our definitions of doing well are different than our doctors. And make sure to stay till the end, because I always give some practical conversation starters you can use with your doctor to take all of this information and apply it to your own situation. So let's get started. Remission as a concept in rheumatoid arthritis is a reasonably new thing. It was only because of the development of biologics that we could get close enough to it that we decided we should probably define this thing so all rheumatologists know what to aim for. So the American College of Rheumatology and the European League Against Rheumatism have established that in RA, remission is when someone has no visible signs or symptoms of RA, have only one or fewer swollen and or tender joints, and have a CRP blood level that shows little to no inflammation. Beyond just this definition, we have a series of disease activity outcome measures. These are calculations that take into account various symptoms, blood test results, and what your joints look and feel like, and then spits out a number. Then, based on that number, we can say you're in remission or you aren't. Because we now have a goal that we can define, we have developed a treatment strategy to get us to that goal. This strategy is called treat to target. Why is this so important? Well, prior to this, the treatments you may be given for your RA were totally based on your doctor's experience, their gut instinct, and their mood. But by having definitions, we can now standardize treatment so someone with RA in Madrid is treated the same as someone in Santiago and as someone in Dallas. As important as numbers and scores are for big scientific research and standardizing care, this is all a bit dry when it comes to what it means and looks like for your life. I've also found that it's lacking that secret sauce that can really tell us if someone is thriving. So here at Connected Rheumatology, I like to add that remission means all that fancy stuff about no inflammation, but also includes that the person is living their life the way they want to live it. But before we get to how you can best do that, let's first look at how remission, or the journey to remission, is monitored from different points of view. From your rheumatologist's point of view, getting you to remission is about keeping track of numbers. The numbers of swollen joints and the numbers of tender joints. They also care about your blood work numbers. There are a few different markers of inflammation we will check. The two main ones being the sedimentation rate, or ESR, and the C-reactive protein, or CRP. These markers are not always right and can be normal in someone with obvious inflammation or elevated in someone without active rheumatoid arthritis. However, they are the best we have at the moment, so they are factored into whether you are in remission or not. If someone is not in remission, then based on the treat to target strategy, the doctor should be doing something to get you closer to remission. So how does this translate to your real life? It means that every time you're seeing your rheumatologist, they are thinking, are we there yet? If not, let's do something, which is usually increase a medication or add a new medication. But this treat to target strategy isn't just about adding meds. The strategy actually states that all decisions should be shared. So who is sharing in this decision? You. It shouldn't be just one person doing all the deciding about when to add or go up on a medication. It's supposed to be shared. So if you aren't ready to make big changes, then speak up. And I'll give you some more ideas about this later on. So we've talked about all the numbers your doctor will be keeping track of. But what can you monitor at home? There are a number of things you can keep an eye on that are very important to notice when aiming for that higher level remission of being able to live your life. The first is to keep a loose count of how many good versus bad days per week you are having. When you are first diagnosed with RA, it is not uncommon for almost every day to be a bad day. Bad can mean different things to different people, but usually means feeling very stiff in the mornings, having difficulty grasping or gripping objects, and having no energy. The goals with treatment is to shift that balance back to mainly good days, although bad days can't usually be prevented altogether. Along with paying attention to good versus bad days, pay attention to your energy level. When we have a lot of active inflammation, it's very common to feel white. Your body is working overtime because of the inflammation, so of course you're gonna be tired. Fatigue can often be one of the last symptoms to get better with immune system medications, so it does require some patience. Is it slowly getting better, or does it feel like it hasn't budged for a while? And then of course, I'm always suggesting to keep track of how much NSAID pain medication like ibuprofen or naproxen you're reaching for. Needing it every day, even multiple times a day, can be a sign of a lot of inflammation, while needing it just once or twice per month is usually someone doing well. When what your doctor is watching matches up with what you are watching, then things are easy, but that's not always the case. Sometimes we can feel okay while our doctor is pushing for more medicine, and many times our doctors can say we're fine, although we still feel like poop. So what's happening here? Well, the first scenario where we feel fine, but our doctor is still pushing, I find is often the result of people no longer feeling like they are hanging off the cliff and wanting to take some time to get used to their new life instead of pushing and pushing more and more medicines. Rheumatologists will often want to keep pushing to get you to remission or as close as possible, but we don't want to lose sight of the progress you've already made, and I believe that when we find ourselves in this position, it's because of just that. We, meaning the docs, aren't appreciating how far we've come. Taking a few months to get used to your medicines is perfectly okay, and like I said, this is supposed to be a shared decision, so letting your doctor know that even though the numbers are saying more, you would like to hold tight where you're at for a while. The other scenario where you still don't feel great, but your doctor says you're fine, is frustrating and unfortunately common. So why is that? Well, with some people, their pain and fatigue is driven by more than just the run-of-the-mill rheumatoid arthritis and is likely more complicated. Nociplastic pain from fibromyalgia or fatigue from mood disorders can cloud things and make it difficult to achieve that higher level of remission where you can live your life. And if you don't know what I'm talking about, I recommend this video on fibromyalgia pain. In both of these scenarios, but especially the latter, I would recommend looking into the lifestyle changes that we know can help with symptoms. Diet, sleep, movement, stress management, and mental health and community are all intimately tied to our immune and nervous system and can influence rheumatoid arthritis symptoms. So how can you start these conversations with your doctor? Is your head spinning from your new diagnosis and treatment? Do you need a breather or want to slow down all the new meds? Just let your doctor know. Remember, this is supposed to be a shared decision. If you have made a lot of progress and are feeling better, but are still needing NSAIDs for pain every day or every other day, I would advise that you don't want to wait for too long, as taking NSAIDs that frequently for a long time can have many unwanted side effects. But waiting a month or two so you can get the ground under you again before starting a new medicine is totally reasonable. Is your doctor telling you you're great, but you don't feel great? What else could be going on? This is where I'm going to suggest taking some time to get specific with yourself. What symptoms exactly are you still dealing with? If you still have pain, is it the same kind of pain you had in the beginning, or is it different? And if it's different, how is it different? Is it in a different location? Does it feel different? Does it happen at different times of the day? Which symptoms have gotten better with treatment and which symptoms haven't? All of this information will help you and your doctor decide, are your numbers just wrong and in fact you still have active RA, or are your symptoms coming from some other place and thus need a completely different approach? And then finally, regardless of the scenarios you find yourself in, out of the lifestyle pillars of diet, sleep, movement, stress management, and mental health and community, which do you think is impacting your symptoms the most. The truth is, we can all probably make tweaks in all of these areas, but there is no need to overwhelm ourselves by saying we need to change everything all at once. First, just notice what area seems to be the most off. That then can lead you to the next step, which is what can you do about it? Do you need a dietitian, a sleep specialist, a therapist, or a coach? It is truly amazing that we now are able to get those with rheumatoid arthritis into or close to remission. But remission and you are more than just numbers. And what is the point of getting there if you still aren't living your life? Paying attention to your symptoms and keeping the dialogue open between you and your doctor about how you're doing and what your goals are and your comfort level with treatment options will help you start to learn how to get back to your life with RA. I hope you found this helpful. It really helps me out if you can like, share, and subscribe. Make sure to also check out the Appointment Home Run Handbook. This can help you organize yourself so that you can better tell your doctor your story so you get answers faster. Also, I invite you to check out the other videos I have in the Rheumatoid Arthritis playlist, and we'll see you next time.